my true honor and privilege to introduce to you the founders of Cure JM, Shari and Tom Hume. This goes back some 18 years, back to the very early years of Cure JM, when Shari and Tom really brought forth the vision for this organization on what was needed for children with JM after the diagnosis of their own son. Let me say that I think because of their leadership, we started out back then, and we're still working on it now, with basic research and funding basic research to understand the causes of juvenile myositis. Under their leadership and vision, we established a network of clinicians around the country and indeed around the world. Have created 4 centers of excellence, have focused on clinician education and training, really bringing up the next generation of JM experts, like Dr. Ardalan, for example. And I think quite importantly, under their leadership, published a book. You may all be familiar with it, called Myositis in You, which is essentially the Bible, if you will, for both caregivers and families in terms of understanding myositis and the paths for improvement for your own children. So it's now my pleasure to introduce Shari and Tom. I have a couple of questions for them to really sort of help put our work today in perspective as we go back in time, looking at the very early years of this. And my first question for them is how is Cure JM different today in its work, and particularly as that work relates to family leadership and research focus?
Well, I think I'll start with the research focus, and going back in time, I think our goal has always been to find the fastest way to reach our mission of a cure and to improve the lives of all of our kids with JM. And at the beginning, we had to find a way to use our limited resources. And we went looking for the experts in JM. And the first one we found was Dr. Lauren Pockman. And we started out with our first center of excellence there and in Chicago, where we were funding research and also supporting that center of care. And to this day, the center houses the largest JM biorepository, which is critical for conducting research and ultimately finding better treatments and a cure. And then with the help of all of you on this call today and others in the JM community, we have been able to grow substantially in size and scope. And now we have 4 centers of excellence, as Jim mentioned. We have Duke now, we have GWU in Washington, D.C., and we have Seattle Children's Hospital.
Yeah, and then we definitely started off walking before we started running. And we had a great medical advisory board that's actually grown and really does have the top researchers in the country of JM. And then we started to move into providing grants. We developed a grant program that worldwide top researchers could come and seek grants from us for research. And then what I think is the most exciting part is then we developed a grant program for fellowships. So this really is bringing the next generation of researchers to get them excited about JM as a subject or an area that they would like to research.
And I think as more dollars came into Cure JM and as we grew, we were able to start focusing more on drug development. And that's what Dr. Ardalan was talking about today. And with this drug symposium that happened 2 weeks ago, that we're in gratitude to Andrew for pulling together and the other people that worked on it. Again, Dr. Ardalan, how many times can I mention your name tonight? And other folks at Duke. So having that event was literally a dream for us as co-founders. That was something we always wanted to see happen. So having the drugs like baricitinib, abatacept, and also vamorolone, seeing those drugs move forward is, I think, a really big step for us at Cure JM and for the JM kids. with vamorolone, seeing that move into a potential clinical trial is what we're looking at for CureJM, and that's really exciting for us. So we're working with RevereGen and Duke on pulling that together.
You know, and another area that we really gained an understanding of a need for really from the JM community was mental health. And that through focus groups done at conferences, through surveying, this was a gap area. And now we actually do have resources on our website that are available to families to take advantage of. Equally, and this is very, very important, CureJM is actually funding a child psych at our Center of Excellence up in Seattle. And they're working on different assessment tools for JM children, but also families too. And that psychologist is also working with Dr. Ardalan and also Brian Feldman up at Sick Children's up in Canada on a whole mental health assessment tool. And really, at this point, I just have to give a big shout out to Suzanne Edison, who has worked relentlessly to bring this whole project to fruition. And really, just it is remarkable when you, for us, looking back. I mean, CureJM has funded over 175 different research studies, and that has improved the treatments and moving us all closer to hopefully our mission of a cure. And CureJM has invested over $16 million in research or education or family support, really making it the largest funder of JM support and research in the world.
So I think we over-answered your question. That was one part of it. In terms of the family leadership part of it, I think when we first started, Parker was diagnosed 18 years ago, and I immediately went to the computer. I think that was AOL back then. And I sent out a message. Facebook did not exist at that time. And I found some message board and just tried to find anyone that had JM. And I got one response, one lonely response from a woman named Carrie Bowler. And thank goodness she lived only 15 miles away from us. So we got together and realized that we needed some type of organization for these kids. And a year after Parker's diagnosis, we did start CureJM along with her daughter-in-law. So the four of us started CureJM. And we started out with a small board of directors of parents with JM children, and then established a family support network, which is still in existence today, of course, growing. And then our patient registry is a big part of CureJM, started long ago, which now is 3,000 families strong. And I think every one of those families is a huge part of our organization. All of them are leaders in our organization.
And then over time, we added advisory councils. And then right around the 10-year mark, we realized, and we had been an all-volunteer organization, and we really realized to get to that next step, we really needed a staff of professionals. And we brought in Shannon, we brought in Jim, others over time that have really just helped us accelerate our mission and everything we're trying to do. On top of that, we've established a National Leadership Council with over 150 families. Of course, now today we have 19 chapters and over 80 chapter leaders. That's 4 per chapter. And then that has spurred an outgrowth with the walk leadership for our big fundraising. So it's, for us, it's wonderful because we've seen great growth.
Yeah, and I think, credit to Jim there. Jim came in and had this idea for the regional chapters and the walk program. So that's all Jim's idea on how to get us to this next step. And so that's how we were able to get all of these new leaders in the leadership council. So thank you to Jim for taking us to that next level. Just to wrap this section up, I was going to say we have grown substantially in both research efforts and family leadership. But just to compare to where we were 18 years ago and now, if you were to reach out on a message board such as Facebook Caregivers, which now has, I checked today, and it has almost 1,400 members. So if you send out a message today, you will get more than enough responses and help that you can really feel good about and know what to do versus that one response that I think it took a week to get an answer.
One response, yeah.
One response, yeah.
as you mentioned, Parker was diagnosed 18 years ago, so it's been a long haul for your family as you've seen this organization grow. How have you witnessed and how have you yourself drawn strength from other families and from the JM community as you've had to deal with these challenges of living with juvenile myositis?
Yeah, I think we draw strength from both the families, the community, and then also the children and the adults that are affected by it. I think especially the children and the adults fighting the disease every day, they show this resilience and determination on a daily basis that empowers us, it's humbling to us, and then it emboldens us and ignites us with this passion and this purpose to go and fight another day and to really work on our cause. And it's just empowering for us.
I think also, you said it, and we draw strength from other families, that it's that knowledge of a shared experience. It's that I can tell a story to another JM family and they'll get it. They'll understand exactly what we're going through. And it's kind of sort of, it's been a very organic growth for our organization just with the families. It's almost a very wiki or a very crowd sourcing kind of thing that's just evolved. And that's what's created this momentum for us all. I think it's just so critical to, and everyone who sees it, unfortunately, this hasn't been a year for, a lot of face-to-face conferences, but even events like this just give us the chance to get together with each other and talk a little bit and share. And it's that sharing that really helps us, motivates us, and helps all the families, really.
And finally, what closing words of advice would you have, especially for families who are somewhat new to their JM journey?
Yeah, I think for us personally, or for me personally, to make sure that you focus on the entire family. I think I spent a lot of my time on the child with JM and not as much time as I should have spent on the siblings. So I think if you have other children, make sure you spend time with all of them, individual time. And I think also making sure that you take care of yourself. For me, that means running. And for others, that might be taking a walk or doing yoga or reading or whatever that might be, but just to make sure that you take care of yourself so you can take care of others. And then
yeah, and I think words of advice, especially for new families, I would approach each doctor's visit almost as a business meeting, that you have objectives and you have goals and you have things you want to get out of that meeting. And the more organized you can be going into that with your questions, outlining what you want to understand and get through to the doctor about, the more successful will be, and the more, honestly, credibility you'll gain from that doctor in return, and respecting you and what they can do for you. I think that's also very important to, work with your child even before the appointment, and maybe explain, depends on the age of the child, of course, but explain kind of what the process will be, what you'll be going through with the doctor. And then lastly, infusions, they're kind of the bane of our existence a little bit, time in infusion centers. As much as you can, make those a little bit of a fun event, bringing toys, snacks, that type of thing. Of course, in a non-COVID time, maybe even bring other family members in to share in that experience. I think that's good.
And then I think in terms of how you empower yourself as parents, to try to become an expert on your child's disease and learn everything you can, and to advocate for your child, because they're watching us. And as we've seen our kids turn into adults and go to the hospital on their own, now they're learning how to advocate for themselves, and they're doing the same things that they watched us do for them. So keep that in mind. And then what you guys all do is provide emotional support for other families, and that's very critical. And then also just to get involved with Cure JM and whatever way that is again, providing emotional support or through fundraising.
Or even studies, as Dr. Artemar.
Oh yeah, critical
Mhm.
is the research study. It's very important. And Jim's going to get into the Giving Tuesday event, but that's a great way to get involved. And what we found is, I know that first ask is always hard if you're new to it, to ask someone for that donation, but it gets easier over time. And we found that friends and family, they actually do want to help, and they sometimes say, how can I help you? And for them, that's actually an easy thing to do. For some families, not everyone, but if they can't give, sometimes they can share a Facebook post, or share an email, or help in some other way. So I think
Yeah, I think you'll be surprised, especially, and again, Jim will get into more of the contest or the event coming up for fundraising, but people will come out of the woodwork that you would never expect that will donate. And even I've seen year after year, people are asking me now, when are you doing Giving Tuesday? And already very interested in helping. And people who you just were maybe just acquaintances with, but something about your story really struck a chord with them. And they know that a donation to Cure JM really is going to make a difference, because we're not a big cancer foundation. We're not, we just don't have the numbers of a lot of other foundations, but definitely we have the heart and spirit of a lot of other foundations.
And I think maybe just to wrap it up, I think something that's always motivated us are reading motivational quotes and sayings. And one of the quotes that I think always relates back to Cure JM and all of us as a group, and it's even in the Myositis in You book, is a Margaret Mead quote that says, "Never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it's the only thing that ever has." And I think that speaks to all of us and what we do for Cure JM. So thank you.
Yeah.